Welcome to the Maternity Mentor. Today we will be talking about the top 10 ways to naturally induce your labor. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Once you've reached 40 weeks gestation, you may be anxious to get labor started. There are many natural methods that may help encourage labor to start. None of these methods should be used without the guidance and knowledge of your healthcare provider. They know you, your unique pregnancy, and are aware of any conditions and medications for which these methods are not recommended. You should be aware that most natural ways of inducing labor have not been proven through scientific study. However, anecdotal evidence often contradicts this. The most important thing to remember is to be patient when having your baby, and that none of these things should be used prior to 40 weeks unless directed by your healthcare provider. Now let's explore the top 10 ways to naturally induce labor. First up is nipple stimulation. Stimulating your nipples causes the production of oxytocin. Oxytocin is a hormone produced in our bodies that helps the uterus contract during and after labor. Stimulating your nipples enough may cause labor contractions to begin. Some of the benefits of nipple stimulation include: it can help avoid needing a medical induction, it can be an effective and natural way to induce or augment labor, and it can help prevent postpartum hemorrhage after birth. There are 3 ways to practice nipple stimulation: manually yourself, manually by your partner, or using a breast pump. Another added bonus is stimulating your nipples can start to send the right signals to your body for producing breast milk. And any colostrum that is expressed can be stored and frozen for the baby for later use. For more information on safe storage and handling of breast milk, please see our video on this. We will link that in the description below. Next is red raspberry leaf tea. Used for many years, red raspberry leaf tea is a common recommendation made by midwives. The tea is used to strengthen the uterus and increase its tone. This can help prepare the uterus for labor and may start contractions. A nice bonus is that drinking the tea will help keep you hydrated even if it doesn't start labor. The tea is also full of iron and calcium, which means it's good for mom and baby. Next up is evening primrose oil. Evening primrose oil has been used for years by midwives. This is an herbal supplement that can help thin and dilate the cervix. This prepares your body for labor and in some cases may even start labor through the release of prostaglandins. These capsules are taken in the evening before bed. Women who are having pregnancy complications like placenta previa should not use evening primrose oil. A different herb commonly talked about is black cohosh. Black cohosh also has been shown to prepare the uterus for labor. However, this herb has been associated with fetal stroke and heart failure, as well as maternal complications during birth. Cohosh should not be used unless under direct guidance from your healthcare provider, who has discussed the benefits and the risks with you. Additionally, all herbal supplements, including red raspberry leaf tea, evening primrose oil, and cohosh, must be discussed with your healthcare provider. Herbal supplements are not regulated for quality or effectiveness in the United States and frequently interact with other medications, including the medications that may be given to you during your labor. Bottom line, always talk with your healthcare provider before starting any herbal supplement. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about exercise. Another method to naturally induce labor is exercise. Increasing your heart rate is thought to stimulate the body in ways that start contractions. One way to do this is by taking a long walk. If you are exercising, it's important to stay hydrated. Contractions will start with dehydration, but dehydration can be dangerous for both mom and baby. Climbing stairs may open up your pelvis and help your baby get into the correct position for labor. A bonus of exercise is it reduces stress and gets you in good shape for labor. However, research hasn't proven that exercise will help your labor begin. Next is acupuncture. Acupuncture has been used for thousands of years for a variety of reasons. Acupuncture's exact mechanism of action is unknown, but it is thought to stimulate the nervous system and changes in hormones, including increasing oxytocin. Acupuncture should only be performed by a licensed acupuncturist. The provider will insert thin needles into specific points in the body to stimulate uterine activity. Acupressure and massage are another method used to stimulate labor. Acupressure is the use of applied pressure on certain points of the body and should also only be performed by licensed providers. Both acupressure and massage are thought to stimulate oxytocin production in the body, which can stimulate contractions. Study results have not shown that acupressure or acupuncture will induce labor, but anecdotally it has been used for years. Either way, these can both be very relaxing and stress-reducing before your baby arrives. Castor oil is one of the most common recommendations for inducing labor. Castor oil is a laxative that causes uterine irritation that may start contractions. It is also said to release prostaglandins, which can help to ripen the cervix. The problem with castor oil is that it can also cause upset stomach, vomiting, and diarrhea. If you drink too much, it can cause serious problems, so be sure to contact your healthcare provider. Castor oil can also leave you feeling exhausted, sick, and dehydrated. Spicy food is another technique some women try to use to induce labor naturally. Just like castor oil, the spicy food irritates the gastrointestinal tract, which can cause uterine contractions. However, this method can also leave you feeling sick and bloated and may cause a nasty case of heartburn. Most healthcare providers will recommend that you steer clear of both of these methods because they are not very effective and they can leave you feeling worse than when you started. Next up, to help induce labor naturally is eating dates. Some research indicates that eating dates in the final weeks of your pregnancy may assist with cervical ripening. Cervical ripening is needed for cervical dilation or opening of the cervix to allow the baby to be delivered vaginally. There is also some evidence that shows eating dates reduces the need for Pitocin during labor. In fact, eating 6 dates per day for the 4 weeks leading up to your due date may decrease your need for a labor induction. Finally, sex is a common form of trying to induce labor, and for good reason. There are multiple ways why this might work. First, having an orgasm can release the hormone oxytocin. Oxytocin can stimulate uterine contractions and start labor. If you're having sex with a man, the semen contains prostaglandins. Prostaglandins can also help ripen the cervix, readying it for labor. However, some studies have shown that women who have sex late in pregnancy may actually stay pregnant longer. Ultimately, however, unless your healthcare provider has advised for you to practice pelvic rest, having sex now is a great way to stay connected with your partner before your new baby arrives. For more information on great sex during pregnancy, please see our video on this subject. We will link that in the description below. Many women will go into labor naturally before 40 weeks of pregnancy. However, for those who don't, utilizing a natural method to induce labor may help labor start. I hope this has explained some natural induction methods that you can discuss with your healthcare provider. And remember, it's always best to wait until your baby is 40 weeks. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.